A monk places a small piece of dried root on his tongue. His hands are steady. His eyes are clear. His weight is lean from decades of physical labor and disciplined eating. He is 67 years old. He has never heard the word diabetes. Neither had most of his community. The infirmary records across 40 years document not a single case of what we now call type 2 diabetes. Outside the walls, the disease was already present. Blinding, amputating, killing. Inside, something in the garden, the kitchen, the fasting calendar, and the daily rhythm of work and prayer made all the difference. And a $50 billion industry has spent decades making sure you call that luck. Stay with me. Number 3 is the spice. A 2003 landmark study found reduces fasting blood sugar by 29%. Monastery kitchens used it daily for 700 years. Number 8 works in 30 minutes, confirmed by 3 separate trials. And number 14 is the Monastery fasting protocol. A 2019 trial confirmed reverses early type 2 diabetes in 11 weeks. Number 1, apple cider vinegar, the monastery's blood sugar break. Every monastery kitchen produced it. Administered before the largest meal with the consistency of medicine. Raw apple cider vinegar diluted in water. Documented in Cistercian and Benedictine records for excessive hunger, lethargy, and thirst that medieval physicians recognized as pre-diabetic distress. Acetic acid inhibits alpha-glucosidase, the intestinal enzyme breaking carbohydrates into glucose. Vinegar slows glucose entry into the bloodstream, flattening the spike and crash cycle that destroys insulin sensitivity over years. A 2004 trial in diabetes care found 2 tablespoons of apple cider vinegar before a high-carbohydrate meal reduced post-meal blood sugar by up to 34% in insulin-resistant participants, 34% from 50 cents of vinegar. The monks consumed it daily without knowing the biochemistry. Number 2. Bitter melon, the Eastern monastery's pancreas herb. In the monastery hospitals of India, China, and the Arab world, one vegetable was consumed specifically for what ancient physicians called excessive sweetness of the urine. Memordica cerantia, bitter melon, recognized independently in 3 separate monastery medical traditions as a specific treatment for what we now call diabetes. Bitter melon contains charantin, reducing blood glucose through insulin-like mechanisms. Polypeptide P mimicking insulin at receptor sites, and vising stimulating glucose uptake independently of insulin. A 2011 study confirmed bitter melon significantly reduced post-meal blood glucose and HbA1c with regular consumption. 3 independent ancient traditions. Same plant, same condition, 3,000 years before the word endocrinology existed. Number 3. Cinnamon, the blood sugar spice they cannot patent. This is number 3. The landmark study. In 2003, a diabetes care study found 1 to 6 grams of cinnamon daily reduced fasting blood glucose by 18 to 29%. LDL cholesterol fell by up to 27%. Triglycerides by up to 30%. Fasting blood glucose reduced by 29%. From a spice that costs $2 per jar, cinnamon contains MHCP, activating insulin receptors and mimicking insulin signaling. It inhibits alpha-glucosidase and reduces inflammatory markers, damaging insulin pathways, addressing root cause, not just symptoms. Monastery kitchens used cinnamon daily, in morning preparations, infirmary teas, dietary prescriptions for monks showing metabolic sluggishness. They had been running the same experiment the 2003 study formalized for 700 years. Number 4. Fenugreek, the monastery's seed remedy for sweet blood. In monastery kitchens of the Middle East and India, 1 seed was prescribed for excessive hunger, excessive thirst, and energy weakness unresponsive to food. Trigonella Phenom Greek. Fenugreek contains 4-hydroxysilucin, found almost exclusively in this plant, directly stimulating insulin secretion from beta cells that type 2 diabetes progressively destroys. Its galactomannan fiber forms a viscous gel, slowing glucose absorption with mechanical reliability. A 2009 meta-analysis confirmed fenugreek significantly reduced fasting and post-meal glucose, and a 2020 review found it reduced HbA1c with 12 weeks of use. The monastery kitchens used it as a daily staple. Their blood sugar remained controlled. Number 5. Berberine, the root that performed like metformin. In the great monastery pharmacies of China, one compound appeared in several plants used across multiple conditions. Monastery physicians did not know these plants, golden seal, barberry, Oregon grape, all shared the same active compound, berberine. A 2008 study in metabolism compared berberine directly against metformin, the world's most prescribed diabetes drug. Berberine reduced fasting blood glucose by 20%, post-meal glucose by 26%, and HbA1c by 18%, virtually identical to the metformin group. Identical to the world's most prescribed diabetes drug. From a plant compound monastery pharmacies had dispensed for centuries. Berberine activates AMPK, the metabolic master switch, almost exactly as metformin does. It cannot be patented, costs $20 per month. Stop here for a moment. 5 remedies, all monastery, all confirmed by peer-reviewed research, some finding direct equivalence to leading pharmaceutical drugs. Your endocrinologist has mentioned none of them. Leave a comment now. Tell me which you already use. The $50 billion diabetes industry needs this invisible. Number 6. Monastery fasting. The insulin reset. The Benedictine fasting calendar was designed for spiritual discipline. But fasting 150 days per year, Advent, Lent, Fridays, Vigil days, forced the pancreas, the liver, and the cellular insulin signaling apparatus to rest, reset, and repair at regular intervals. During fasting, insulin falls, receptor sensitivity increases, cells restore their response. The liver reduces glucose output, beta cells chronically overstimulated by constant eating, rest, and recover. Multiple trials confirm intermittent fasting improves insulin sensitivity and HbA1c. A 2019 cell metabolism trial found time-restricted eating reversed early type 2 diabetes markers in 11 weeks. Reversed from the practice the monastery calendar enforced since the 6th century. Number 7. Gymnema sylvestre, the sugar destroyer. In the Ayurvedic monastery tradition, one leaf's name translates directly as destroyer of sugar, Gymnema sylvestre. Gymnemic acids block the ability to taste sweetness and also block the absorption of sugar molecules in the intestine, physically preventing glucose from entering the bloodstream at normal rates. Monastery physicians observed that gymnema reduced the desire for sweet foods and improved symptoms of excessive thirst and urinary sweetness. A 2001 study found gymnema extract significantly reduced fasting glucose and HbA1c, with some patients reducing medication dosages under physician supervision, destroying sugar, as its name promised. Number 8. Ceylon cinnamon tea, the 30-minute protocol. This is number 8, the one that works in 30 minutes. Ceylon cinnamon, Cinnamon verum, is the specific variety used in monastery medical preparations and documented in the earliest European monastery herbals. Steeped as tea for 15 minutes, it delivers MHCP in water-soluble form that inhibits alpha-glucosidase and enhances insulin receptor function simultaneously. 3 randomized controlled trials found measurable post-meal blood glucose reductions within 30 minutes of Ceylon cinnamon tea consumption sustained for 2 to 3 hours, 30 minutes. 10 cents. The monastery produced this preparation routinely. Every diabetic medication targeting post-meal glucose spikes overlaps substantially with what this stick of bark achieves. Number 9. Chromium-rich monastery foods, the insulin cofactor. Here is a deficiency the modern world created almost deliberately, and the monastery diet avoided without trying. Chromium, the trace mineral essential for insulin's action at the cellular level. Without adequate chromium, insulin cannot bind effectively to its receptor. Blood sugar control deteriorates, producing functional insulin resistance, driven not by insulin dysfunction but by a missing cofactor. The modern food system strips chromium through refining and soil depletion. The monastery diet consumed whole grains, fresh garden vegetables, legumes, and organ meats, all rich in bioavailable chromium. The monks consumed adequate chromium daily through a diet that had never been processed. A 1997 landmark diabetes study found chromium supplementation significantly improved blood glucose and HbA1c, proportional to the severity of deficiency. The monastery never had the deficiency. The dramatic rise in type 2 diabetes correlates almost perfectly with chromium depletion from the industrialized food supply. Number 10. Mulberry leaf tea, the Silk Road blood sugar secret. The great monastery universities of the Arab world traded along the Silk Road, and along those routes came knowledge of a tea consumed in Chinese monastery communities for blood sugar control. Mulberry leaf tea. From the same tree whose leaves fed the silkworms, mulberry leaves contain deoxynitroglycerin (DNJ), inhibiting alpha-glucosidase with potency comparable to the pharmaceutical drug acarbose. Same enzyme, same mechanism. Chinese monastery communities drank it for this purpose 1,000 years before the pharmaceutical version was patented. A 2007 study confirmed significant post-meal glucose reduction. Number 11. Turmeric and black pepper, the inflammation protocol. Type 2 diabetes is an inflammatory disease established in the scientific literature. The chronic inflammation driving insulin resistance is produced by the same pathways curcumin inhibits. NFKB, the master inflammatory transcription factor, drives insulin resistance. Curcumin inhibits it directly. Monastery medicine consumed turmeric daily with black pepper. Piperine increases absorption by 2,000%, addressing the inflammatory root cause without knowing the vocabulary. A 2012 trial found 9 months of curcumin prevented pre-diabetes progression. 0% of the curcumin group developed diabetes versus 16% of the placebo group. $2 per month. Number 12. The Monastery Physical Labor Protocol. Type 2 diabetes is also a disease of stillness, and no drug can replace what movement provides. Skeletal muscle contraction directly stimulates glucose uptake independently of insulin. Every contraction during physical activity reduces blood sugar without requiring insulin signaling. This pathway type 2 diabetes leaves entirely intact. The monastery schedule was a continuous activity protocol. Walking to prayer 7 times daily. Agricultural labor. Carpentry. A monk never remained sedentary for more than 90 minutes. Modern diabetes guidelines recommend 150 minutes of activity per week before medication. The monastery provided this every single day. Number 13. Bitter herbs and the monastery digestive activation. The monastery pre-meal ritual included bitter herbs, gentian, wormwood, dandelion root, before every main meal, consumed for digestion. But bitters do something specific to blood sugar metabolism. Bitter compounds activate receptors that stimulate GLP-1 release, glucagon-like peptide 1. GLP-1 is the target of the most profitable new class of diabetes drugs, semaglutide, sold as Ozempic and Wegovy. The monastery activated the GLP-1 pathway through bitter herbs before every meal for 700 years. Same pathway. No prescription, no nausea, no cost. Number 14. The monastery grain system, the low glycemic foundation. The monastery ate grain, not the grain you know. Long fermented sourdough from ancient spelt and einkorn, glycemic indices significantly below modern wheat. Whole grain porridges with fat and protein. Legumes at almost every meal, providing resistant starch that maintains insulin sensitivity. The modern food system replaced all of this with refined white flour approaching pure glucose in glycemic index. 3-hour commercial yeast bread, and meals stripped of the fiber slowing glucose absorption. The monastery diet produced a post-meal blood sugar curve modern continuous glucose monitoring would describe as enviably flat. The modern diet produces the spike and crash profile that, repeated for decades, produces type 2 diabetes with mathematical reliability. The monastery ate bread, so can you. Just not bread processed into a glucose delivery mechanism. Number 15. The monastery blood sugar ritual, the daily system. We end with the complete picture. The monastery monk was not protected by any single remedy. He was protected by all of them as an integrated daily system. Physical movement on waking, whole grain porridge and bitter herbal tea with cinnamon and fenugreek. Apple cider vinegar before the main meal. Fermented bread, legumes and garden vegetables. Cinnamon tea after eating. Regular fasting days resetting insulin sensitivity, and continuous movement through every day, never sedentary, never consuming glucose without simultaneously burning it. No single element was designed for blood sugar control. The whole of it was a spiritual way of life that produced perfect metabolic health as its byproduct. The $50 billion industry replaced it with pills that manage symptoms without addressing causes. Pills taken for life because they change nothing fundamental. The archive is open. What the monastery knew has always been free. They built a $50 billion industry on a disease the monastery almost never had. They suppressed every natural intervention that could not be patented, and they called the result modern medicine. The monks called it breakfast. Share this with someone whose blood sugar is struggling.